Yeah, we're discussing the race predisposition in neuromyelitis optica, not only in the risk of getting NMOSD to begin with, but also the outcomes. What we found putting our data together with a group in New York City is that mortality rate for African Americans with NMO is higher than in non-African Americans. And it's not just a slight difference, it's really a much bigger difference. Out of 30 deaths related to NMO, 27 were in African Americans. So while they make up 90% of the mortality, they're only 41% of the data set in total. So there was a huge disparity there. We're trying to figure out why that disparity exists, if it's access to care, or if it's response to certain medications, or if it's something innate in the immune system that may be genetically based. I would say there's just an increasing awareness that's beginning now, and there are a lot of genetic studies that will allow us to look into that further, but it's nothing that has yet launched. But I think this is really the first time that we've gotten together as a group to discuss those disparities. I think one of the biggest uncertainties is response to medications. If you look at the clinical trials, the proportion of patients who are of African ancestry make up less than 20% in all three of the different trials that were done. And yet the proportion of patients is well over 40%. So it's really a big disparity there. We assume that the medications would be useful across all races, and that's how the FDA and other authorities didn't necessarily divide that up and approve it in different races, but we need to figure out if these medications are as effective in each race.